2 months ago, the field hospital number 1, also known as the second facility of Cần Thơ General Hospital, located at the Politics School, was put into operation. It has eased the pressure of upper-level hospitals when having killed hundreds of asymptomatic and mild COVID-19 patients. Despite being exposed to higher risk of infection, health professionals at the field hospital number 1 always make their best efforts to have patients recover.
The departure day was without flowers or Thai hugs, but the doctors and students living for the fight against COVID-19 in Field Hospital number 1 were well aware that they were assigned with a noble mission. From the first day of operation, Field Hospital number 1 has been fulfilling the expectations of leaders and people of the city when having successfully cured over 519 COVID-19 patients.
The treatment test here is not very complicated in terms of expertise, but requires a lot in terms of patient care and logistics. For example, patients' daily meals and hygiene must be ensured for their comfort during recovery. Each of the field hospital staff is assigned with a specific task for the smoothest operation and collaboration, doing everything we can for the patients.
Among the folks assigned at Field Hospital number 1, there are plenty of young doctors and physicians who volunteer to join. Dr. Ngô Duy Thái is one of them. Despite his young age, with the voluntary spirit of a young party member, Dr. Thái and his colleagues stayed on duty at the treatment unit, giving their best for the job. Besides taking the role of physicians, the doctors here are both mental health specialists and nutrition specialists, for the patients are on their own at the hospital. This adds extras to the doctor's responsibilities.
At this field hospital, apart from treating patients' symptoms, it's essential to take care of their mental well-being. We see patients as our family members and advise them to take care of their health for recovery. We try our best at work so that both patients and doctors can soon go home.
Every health workers and volunteers at Field Hospital number 1 has their own circumstances, but they chose to set their personal thoughts aside to support the patients. All share the faith, determination, and the spirit of physicians are like mothers.
Health workers who have family or children at home can feel homesick sometimes. We inform our families that the field hospital leaders take very good care of us in both personal and professional aspects, so our families can rest assured. As a young party member and a youth union officer of the university, all the doctors and I joined the volunteers at the field hospital when mobilized. I also pioneered in preparing instruction for our successors, as well as spreading the voluntary spirit to everyone.
The battle is long and difficult, yet the efforts and silent sacrifices of the volunteer health workers on the front line of treating COVID-19 patients will contribute to the city's joint goal of defeating the pandemic.